yes.
As you wish.
Okay. आओ मेरी तरफ आओ.
Yes, doctor.
Come. So कब से लिम्प आ रहा है लगभग डॉक्टर साहब? Now go back once again. Just keep talking to me. And
Limp.
Back.
Exactly limp आ रहा है 2022 से नवंबर में.
Okay. Come and then go back.
Okay.
Turn towards the wall and then go back.
Okay, I will turn to the wall.
No. Come towards me.
Okay, then I will turn to the wall.
Yes,
Okay.
yes. Okay, and now go back.
खटखट आवाज हो रहा है.
So crepitus आप feel कर पा रहे हो?
हाँ, बहुत जबरदस्त.
Come once again.
Yeah.
And how about stairs? Stairs is difficult.
I hold the railing and then one by one step करके हम
वापस आ जाएंगे. कंफर्टेबल है
एकदम से कंफर्टेबल है.
बढ़िया, ठीक है. एक बार स्टेप नीचे.
ओके सर. नीचे
तो डॉक्टर अर्नब, हम जब पहले मूव करते थे ऐसे तो बहुत दर्द होता था,
बहुत दर्द होता था.
तकलीफ होती थी. अब दोनों बायलैटरल हमने एक साथ किया था.
एक साथ बायलैटरल हुआ था.
अभी मूव कर रहा हूँ.
कोई दिक्कत नहीं.
ठीक है. और पालथी वगैरह लगाना हो तो
कोई तकलीफ नहीं.
लगा के दिखाएंगे एक बार पालथी. अरे वाह, फर्स्ट क्लास. ऑपरेशन के पहले नहीं लगा पाते थे?
नहीं, रुक गया था. लाइफ पूरा रुक गया था मेरा.
बहुत बढ़िया. टेल मी हाउ bad it is in daily life for you. Like what all are you facing in daily
It's
life?
totally bad because I have become trans-disabled. I cannot go about my daily needs. I can't even sit in the commode properly. Getting up, sitting down is very difficult. Getting down the stairs, climbing the stairs is very difficult. Then again doing OT at the hospital, coming down from my car, getting into the car. These are extremely difficult.
So these are daily activities which we have to go through.
Exactly.
And tying laces, then getting your shoes
Actually,
out.
usually I use lace-free shoes.
Because
yeah,
you cannot.
I can bend. I can pare my nails. Okay, I can
Right.
reach my nails. My father used to pare my nails for me.
Right.
I couldn't get to my knees and ankle also.
Becoming a painful condition.
Very stiff and painful condition.
So how was the life before the surgery, and for how long did
Very
you try?
painful.
How long did you
very
bear
painful.
it?
1.5 years I struggled with regenerative therapy. Then I went for stem cell. Everything failed. And I couldn't turn at the bed.
Right.
Okay, I couldn't sleep.
Like someone who is not able to turn in the bed, forget about sitting cross-legged.
See, forget about sitting cross-legged. It was such a painful life, and most problem was that I couldn't sleep properly, and the next day I had to perform at OT.
Wow. Oh my God. What a stress.
What a stress!
And then you have to
Just
walk
imagine.
and then climb stairs.
Climb stairs, and I stopped climbing stairs at that moment because I couldn't take the load. I used to take the elevator, but again, that walking the
It's a
corridors,
stress.
walking
Mental
the corridor
and physical.
and the patient level stress you have to take to cure that patient.
Exactly. That's another problem which the doctor has, that you have to treat the patient, and when the doctor
For
becomes a
1.5
patient.
years, I have not taken any leave.
Oh
All
my
my
God.
leave were exhausted
My God.
because I had to run hospital after hospital to search for somebody who had to cure me.
Right.
Then somehow I found you in YouTube, and thank you, doctor. Thank
You're
you so
enjoying
much.
your life.
Yeah, back to my normal life.
आप सोचो कि जब सर्जन की हम सर्जरी करते हैं तो उनको इनसाइड आउट सब पता होता है, वो सब रिसर्च करके आए होते हैं. इट्स अ डिफरेंट लेवल ऑफ कॉन्वर्सेशन व्हेन वी ऑपरेट अ सर्जन.
So today we are with Dr. Arnav, right? Dr. Arnav. So you are opthal, है ना?
Yeah.
आप खुद सर्जन हैं, and you come a long way.
Yeah,
West
from
Bengal से
Kolkata.
आप आए हैं. So we are having problem in both the hips, right?
Both the
And
hips,
since a lot of months you are having,
Yeah,
right?
yeah.
And
Almost 2 years.
now we've already examined you. Abduction is lost, adduction is lost. We already tried stem cell once.
Yes.
It didn't work. So tell me how bad it is in daily life for you. Like what all are you facing in daily
It's
life?
totally bad because I have become trans-disabled. I cannot go about my daily needs. I can't even sit in the commode properly. Getting up, sitting down is very difficult. Getting down the stairs, climbing the stairs is very difficult. then again doing OT at the hospital, coming down from my car, getting into the car. These are extremely difficult.
So these are daily activities which we have to go through.
Exactly.
And tying laces, then getting your shoes
Actually,
out.
usually I use lace-free shoes.
Because
yeah,
you cannot.
I can't bend. I can pare my nails. Okay, I can't
Right.
reach my nails. My father used to pare my nails for me.
Right.
I couldn't get to my knees and ankle also.
Becoming a painful condition.
Very stiff and painful condition.
Right. So why did you decide coming all the way from there to here?
Actually, when stem cell failed,
Right.
I had my back to the wall.
Right.
I started searching whether there is modern development in hip surgery.
Yes.
Then I came to know about superpath technology.
Yes.
I saw it is being done successfully in Australia.
Yes.
Then I started searching who is doing this surgery in India.
Right.
I found two surgeons, one and one you. So when I started seeing your videos, it was so beautiful. Then you have given a comparison between MISDA and superpath. Then I talked to you, told me about the advantage of MISDA. So when you are doing a muscle sparing surgery and when you are very skilled on this one, I thought you are the best one. I had seen several surgeons. I have seen, I don't want to take the names.
No.
I have seen several surgeons. Yes. But I trusted your work. Your videos are so simple and so self-explanatory.
Yes.
I found confidence in it.
Right.
So I went for it.
So looking at the reports, right now we're planning a bilateral hip replacement.
Yeah.
So we'll be doing it in a couple of days, but we'll be giving you medicines accordingly, whatever is needed, and we'll do a simultaneous bilateral. So we'll do in the same anesthesia. We'll do from the front. We'll be using the Bikini technique. We'll be using the shorter stems, the ceramic implants, and hopefully you'll be walking the very next day, right? So we want के जितना भी आपका problematic life है, you go pain-free from here.
Doctor, I want to say one thing.
Yes.
I am a travel freak guy.
Yes.
I like to travel a lot in car, in jungles, in the hills. Okay.
Yes.
So I don't want to live with a life which has a continuous fear that my hip might get dislocated.
Yes. So that's the biggest advantage of our technique.
Yes, because my muscle strength is weak comparative to the
so we want the natural capsule to be, to be the tight portion actually dislocates from the back. Usually dislocates from the back. So when we cut the posterior muscles, posterior capsule, it always is weak. So when you flex, pops out. So that is the biggest advantage of the DA technique, which we do very commonly. Apart from other advantages, that the blood loss is less, the incision is small, muscles are not cut, so the recovery is faster. You're walking the very first day. It's checked intraoperatively that the component is placed right or not. So you will be able to.
Doctor, explain this thing to me. This life is never straight, okay? Right. If I have flight and fight reaction and I have to use my legs to defend myself somehow, and do I have a chance of getting dislocated?
No,
no chance of getting dislocated.
Even if you kick someone, it will not dislocate.
It is not dislocated.
Even if you sit at the ground, it will not dislocate.
It will not dislocate in simple ceramic with poly.
No chance.
No chance. I don't need dual mobility.
Not at all. With this technique, you don't need it.
With this technique, I don't need it.
Plus, dual mobility has double friction, so the implant life decreases.
They were saying that there is highly cross-linked polymers that are being made. The frictional coefficient is
that polymer we are going to use in this surgery.
That polymer you are going to use in this surgery.
Same polymer which have been made to make it last longer. So this will last even longer.
This will last even longer.
Because the friction is happening only at one surface.
Okay.
So it is just your natural hip. We are not
do
going to damage
you think,
anything.
Doctor, my acitabulum is in proper shape?
Yeah,
is it corroded or
fine.
something like
It's
that?
fine. It has few cysts inside.
Yeah.
But that is a part of reaction.
That is a part of the reaction.
Yeah. So we'll remit.
So I will do fine with this kind of surgery.
You will do just fine. You will travel. Everything will be fine.
Everything will try. I can cycling. I can do
cycling. You can do cross trainer.
Can I do jogging and something like?
You can do jogging, but we recommend not very fast jogging.
Okay, running is not allowed.
Running is allowed in emergency. Running is allowed on a daily basis if you understand that the wear will be faster.
Okay.
Any surface, if you run fast, it's going to wear faster. If you do brisk walk,
दौड़ के बास पकड़ना नहीं है.
डेली नहीं पकड़ना है. कोई पीछे पड़ जाए तो भाग सकते हो.
हाँ, कोई पीछे पड़ सकता है भाग जाता है. डिसलोकेट नहीं करेगा.
See, no chance. आप टेनिस भी खेल सकते हो. So in UK and US, surgery is not taken as a surgery.
Okay.
Because everything is free.
Okay.
So these guys play sports also after the surgery. You're going to use the same implants they use. But they don't fear surgery after 15 years. In Indian mentality, we fear surgery after 15 years because it's expensive, it's not paid off, NHS is not here. So if you have that in mind, you should keep a respectful life for them as well. So if you treat them well, they will treat you well. This is just to increase the life. Not that if अगर चोर पीछे कोई पड़ जाए तो भाग नहीं सकते हम. ऐसा नहीं है. ऐसा नहीं.
हम भाग सकते हैं.
आप भाग सकते हैं. आपको पता भी नहीं चलेगा. एक दो बार में आपको पता भी नहीं चलेगा. But
ऐसा
For
तो
a
नहीं,
longer life, you should not run.
I will never feel that I am having a different hip.
No,
It will totally natural.
Only for till 4 weeks you will feel something is different, and that too nice, because you will feel, wow, it's moving without pain. How is that possible?
Okay.
So you'll feel better and better. Once 6 weeks cross, the cement, the calcium grows inside, then you will feel natural. You will not feel
Doctor,
that.
another thing I want to show you, kindly put on the light. I want to show you one thing. This will enlighten you a bit. You kindly see these two sides. Just a moment, doctor, taking it. You see this gap and this gap. You are seeing this?
Yeah.
This is not the same, doctor. This right one is the medullary cavity is more widened than the left.
So whichever leg you
This is
use
my dreadful-
less, whichever leg you use less, tends to get more osteoporosis. Tends to get weaker. So right has more pain right now. So you are using it less. So the calcium is less.
Not that. I'm talking about the medullary
I know.
expansion.
So the medullary cavity gets wider with osteoporosis, and it gets narrower with stronger
but
bones.
in my problem, that is the crux of the situation, because there is always a tendency for medullary expansion, doctor.
Yeah, I know.
So the stem should be well fixated, because the stem
I
might,
know.
you do a fine surgery, then after 3 or 4 years, this medullary cavity of mine or the marrow of mine makes
It
a
will not
body of the
sink.
stem.
We are going to use a collared stem.
That will remain fixed.
That will remain
I
fixed
don't
at the
need other
calcar.
type of fixation.
No.
The collar stem will be enough, no? Yeah, both side collar stem.
Both side collar stem.
So in any case, the medullary cavity will not be forcible to dislodge that.
It cannot go down.
It cannot go down, or it cannot be eccentric on the hitting the wall and eroding the wall. That kind of thing won't happen. Okay, doctor. That clears the situation. I was worried about
You
this
were
one.
saying something.
The sustenance period.
Sustenance period. And
Rest
how,
of life,
Which period?
sustain after operation.
Yeah.
how long will this hip
system.
processes will last? How long the whole system will work?
The company claims that it can last from 25 to 40 years, but it depends to patient.
Varies patient to patient.
Yeah.
So I can
Minimum 25
expect safely that 20 to 25 years I can have this hip.
Yes. We are going. If we use it well, then it should
After
last.
that,
a
what
little.
will be the
It
process?
might be possible that some part wears. We'll change that again. You again get that life.
Acha.
We don't need more than that.
If it lasts more than 76 of my age, I will cross the silver bridge by then. I am 50 now. Almost 50 now.
All right.
As you wish.
Okay. आओ मेरी तरफ आओ.
Yes, doctor.
Come. So कब से लिम्प आ रहा है लगभग डॉक्टर साहब? Now go back once again. Just keep talking to me. And
Limp
back.
Exactly limp आ रहा है 2022 से नवंबर में से.
Okay. Come and then go back. Turn towards the wall and then go back.
Okay, I will turn to the wall.
No. Come towards me.
Okay, then I will turn to the wall.
Yes,
Okay.
yes. Okay. And now go back.
खटखट आवाज हो रहा है.
So crepitus आप feel कर पा रहे हो.
हाँ, बहुत जबरदस्त.
Come once again.
Yeah.
And how about stairs? Stairs
Okay.
is difficult.
I hold the railing and then one by one step करके.
So, for a doctor to get operated is another story.
Definitely.
So many doubts, so much knowledge.
So much knowledge.
He knows everything in and out.
Absolutely.
So you are a practicing eye surgeon,
Yeah.
है ना? And you practice in West Bengal.
Yeah.
You came all the way to us. How many doubts and fear was there before the surgery?
No, actually, when I searched for a good profile in YouTube, I was searching for super path surgeon.
Right.
Then I heard from somewhere that you do super path surgery. Then your assistant told me, yes, sir, does this. Then I talked to you and you said that super path is much superseded by MISDA.
Yes.
Then I learned from you at MISDA. And when I learned that you are from Wrightington,
Right.
I had no doubts in my mind.
But being a surgeon, there are some kind of doubts, whether I am in good hands or not. So, and how is the life now as compared to it was before?
No, it was miserable, a hellish life that was.
And being a surgeon and being limited, you cannot open your legs,
You
walk.
can't open your leg, you can't walk properly, you don't have any social respect, you feel disgusting like that, and now you are working with high speed,
Normal.
no issues.
How much pain
Everybody was amazed to see me like that back in my hospital.
Right.
That this guy doesn't have any impression of any surgery.
Wow.
Within 1 month, I got back to my job. 1 month.
And even after a bilateral.
Even after a bilateral. Nobody can even imagine in West Bengal.
Exactly.
That's why you have to come in West Bengal. You are welcome here.
So how was the life before the surgery, and for how long did
Very
you try?
painful.
How long did
Very
you bear
painful.
it?
1.5 years I struggled with regenerative therapy. Then I went for stem cell. Everything failed, and I couldn't turn at the bed.
Right.
Okay, I couldn't sleep.
Like someone who is not able to turn in the bed, forget about sitting cross-legged.
Forget about sitting cross-legged. It was such a painful life, and most problem was that I couldn't sleep properly, and the next day I had to perform at OT.
Wow, oh my god, what a stress.
What is stress? What
And
is
you
stress?
had
Just
to walk
imagine.
and then climb stairs.
Climb stairs, and I stopped climbing stairs at that moment because I couldn't take the load. I used to take the elevator, but again that walking the
It's a
corridors,
stress.
the walking
Mental
the corridor,
and physical.
and the patient level stress you have to take to cure that patient.
Exactly. That's another problem which the doctor has, that you have to treat the patient, and when the doctor
For
becomes a
1.5
patient.
years, I have not taken any leave.
Oh
All
my
my
God.
leave were exhausted
My God.
because I had to run hospital after hospital to search for somebody who had to cure me.
Right.
Then somehow I found you in YouTube, and thank you, doctor. Thank
You're
you so
enjoying
much.
your life.
Yeah, back to my normal life.
I feel good that I have made a doctor go back to his routine. Then we both are treating
big
patients
success.
now.
Big success.
Right.
Big success. And when I was working without any walker, the second post-operative day,
Right,
that
right.
was really good.
Because when we met you before the surgery, you had so much pain and so much of stress, and your
much of stress.
father was stressed. Everyone is stressed. at
Everybody
home.
was stressed. And the stress was more of insurance company, whether they will grant or not grant, what they will do. There is another thing.
So many stresses combined.
many stresses.
And to come, this far and get operated, that is also a different
Different
thing.
world.
Yeah.
We never came to Noida before that.
Yeah.
The first time for us.
Yes.
Then everything came out successful.
सब अच्छा लगता है अब.
बहुत अच्छा.
भूल जाते हो कभी कभी सर्जरी हुई है.
एकदम से भूल जाते. एकदम से भूल जाते.
We are so happy for you. So happy for you.
Same here.
Lot
We are so
of
happy for
patients
you.
are there in West Bengal and different part of the world जो लोग quack treatments करा रहे हैं, stem cell करा रहे हैं. What do you want to tell them? Because देखो हम तो बोलते हैं, but you are a surgeon yourself, है ना? जब सर्जन की
Stem
सर्जरी
cell
होती
वाले
है,
जो खुद हैं वो खुद बोल रहे हैं कि जो हिप में है उतना अच्छा रिजल्ट नहीं देते
doesn't work well.
doesn't work. But I had something which wanted me, forced me to avoid this hip surgery.
right?
Okay, I didn't want to lose my marrow. Okay, and
But
so
what
I-
do you recommend to patients who are already in grade 3 or ankylosing?
MISD, I will recommend.
Changes the life.
Yes, it changes the life. Definitely, it is not like the hip surgery you would get by muscle cutting hip surgery.
no.
Not bilateral incision,
the
posterior.
posterior,
No, not the lateral incision, not the posterior incision thing. This is the MISDA, this is a DARP, this is a totally different thing altogether.
You're enjoying your life.
I am enjoying it. I am proud of myself. I searched you and found you.
No, it's all God's
It's
grace.
a God gift.
Yes,
It's all God sent.
Thank you so much.
Thank you.
वापस आ जाएंगे. Good, perfect. Comfortable है एकदम.
एकदम से comfortable है.
बढ़िया, ठीक है. एक बार स्टे.
नीचे ओके सर नीचे आओ सर.
तो डॉक्टर अर्नब, हम जब पहले मूव करते थे ऐसे तो बहुत दर्द होता था,
बहुत दर्द होता था.
तकलीफ होती थी. अब दोनों बायलैटरल हमने एक साथ किया था.
एक साथ बायलैटरल हुआ था.
अभी मूव कर रहा हूँ.
कोई
तकलीफ-
दिक्कत नहीं,
कोई
कोई
तकलीफ
दिक्कत नहीं, कोई दिक्कत नहीं.
ठीक है. और पालती वगैरह लगाना हो तो
कोई
लगा
तकलीफ नहीं.
लगा के दिखाएंगे एक बार पालती. अरे वाह, फर्स्ट क्लास.
एकदम से.
ऑपरेशन के पहले नहीं लगा पाते थे.
नहीं, रुक
तकलीफ
गया
हो
था.
रही थी.
लाइफ पूरा रुक गया था मेरा.
बहुत बढ़िया.
तो डॉक्टर अर्नव खुद एक आई सर्जन है, मतलब आईज के स्पेशलिस्ट हैं, ऑप्थेल्मोलॉजिस्ट हैं, इज अ प्रैक्टिसिंग सर्जन इन वेस्ट बंगाल. जब हमारे पास आए थे, वो सफरिंग विद बायलैटरल आर्थराइटिस. आप सोचो कि जब सर्जन की हम सर्जरी करते हैं तो उनको इनसाइड आउट सब पता होता है, वो सब रिसर्च करके आए होते हैं. इट्स अ डिफरेंट लेवल ऑफ कॉन्वर्सेशन व्हेन वी ऑपरेट अ सर्जन. बट इतनी अच्छी फीलिंग आती है बिकॉज द बेनिफिट्स आर पास टू द पेशेंट. मैंने किसी की सर्जन की सर्जरी करी, वो अब कितने सारे पेशेंट्स को सर्जरी करके उनकी लाइफ पेन फ्री कर रहा है. इट्स अ डिफरेंट फीलिंग. आप देख रहे हो कि इनकी जो आर्थराइटिस थी वो कितनी एडवांस हो गई थी, एंड नाउ ही इज लिविंग अ पेन फ्री लाइफ. कई सारे पेशेंट्स हमारे पास आते हैं जिनको एंकाइलोसिंग होती है, एवियन होती है, they are really having a miserable life. They are not able to get back to work, they are not able to exercise, even go to social functions. If you are one of them, you can contact us, even video call us. Link is given in the description, and you can even visit our Center for Surgeries where we specialize in hip surgeries, and our aim is to make every patient walk pain-free again. Thank you so much and have a nice day.